Welcome to AFMC TV. I'm Robin Linder.
The goal of that is to maximize people's quality of life, right?
You want to make sure that your housing is affordable in your community.
We have to think about vaccines in a way that we haven't thought about them before.
I had a lot of the legislative adults who were very creative.
Down on the floor and play with their kids.
AFMC TV, thanks for watching and have a great day. Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Bonnie Stribling, and she is a health program specialist with the Arkansas Department of Human Services in the Office of Substance Abuse and Mental Health. Bonnie, thanks so much for being here.
Yes, thank you for inviting me. This is a pleasure.
So can you start by telling us what specialized women's services are and why were they created?
Okay, excellent. So Specialized Women's Services is actually a program that's been around for quite a while. They started the services with the block grant, the Arkansas block grant for substance use. We got this back, I think, in the 80s or the 90s, and it was put into law that we have to designate a percentage of the full funding towards women's services. And so Arkansas took that federal guideline and turned it into what is now called Specialized Women's Services. And this targets specifically pregnant women and women with dependent children who experience issues related to substance use disorders. So a lot of our moms that are coming in have these struggles with substance use, but the treatment itself is residential and it is a grant funding, so the mothers don't have to pay anything, which is wonderful. It can be up to 120 days. And the special part that I like to highlight is that you can bring your children with you to treatment. So if these moms have children under the age of 7, they can bring up to 2 kids. Most oftentimes, though, mothers can have other children or children that are a little bit older. That's up to the treatment center's discretion if they're going to be able to accept more of those children. But we try to work with them as much as possible to provide this service, especially residential substance use treatment. It's such an important piece to the puzzle of being able to bring these moms in with their kids and grow and heal together. So these specialized women's services, like I said, have been around, but Arkansas with our maternal health has really put a lot of energy and love and focus into this program to enhance it and bring in some other special services with it that we'll talk about.
Well, that is my next question. How do these programs fit within the broader mission of the Office of Substance Abuse and Mental Health at DHS?
Absolutely. The larger view that DHS is really putting so much work into right now is maternal health. And we want to wrap services around a lot of mothers that are struggling or that may be in harder to reach areas of the state. So Specialized Women's Services is unique in that we are able to maybe catch moms when they wouldn't be caught before. And when I say caught, I mean able to identify moms that have particular issues, but the substance use issue is the one that's easiest to identify because that's the piece of the puzzle that they are getting the services. Once they're in our treatment centers that we work with, then they're able to get wraparound services like any kind of community resources for getting on SNAP benefits or WIC services. If they have a DCFS case involvement, our specialized women programs are able to work with those case managers and family workers to get that case resolved and show the courts that our moms are doing a much better job and reporting and staying clean, getting into recovery. So Specialized Women's Services is it's a good piece of the puzzle because we're able to receive these mothers and then help them on their journey with the other social programs that are available or that are needed for that particular population.
So it sounds like the Specialized Women's Services component is different from other substance use treatment programs.
Yes, it is. And it is very well. And I guess the name Specialized Women's Services it's in the name, right? Specialized for women. And I think that not only is it just for women, but also mothers. So something that's unique for mothers is that when they're pregnant, a lot of times they're not able to go to many different types of services, whether it be withdrawal management services if they're trying to come off of a substance and they need to go to a hospital setting, or if you are pregnant and you may be in a late term of your pregnancy, but you really need help right now, our Specialized Women program are able to help those mothers navigate services and find the right place for them to go or stay with them. And most treatment centers wouldn't accept a mother at a late term pregnancy. So that's just a small piece of some of the specialized services that they offer.
And it sounds like it also addresses the social needs of women, the unique health and social needs, like with pregnancy, parenting, and even trauma.
Oh, absolutely. I just want to do a small plug for myself in this moment because I love this position so much. It speaks dearly to my heart as a mother. So I'm a single mom to a 12-year-old little boy. When I was about 22, I was pregnant and gave birth to my son, but I was actually on drugs at the time. And so while I was pregnant and then even 18 months postpartum, I had been using substances throughout that entire time. And so I didn't know that these resources were available to me. So it was that time in my life was so traumatic and scary that I didn't know who to talk to. I didn't know who to turn to. So I was able to luckily find one or two people in my community that I could share my story with and my fears with. They received me and they were able to help guide me to get clean and off drugs and also away from the person who was causing harm to me. So I consider myself a survivor of that experience. So I'm using that as a way to work with our providers to identify that these moms are going through such a scary time. You know, they're not able to really know how to function when it's such a pivotal point in their life with their children and or pregnant. And so not only are our treatment centers working with trauma, they're also working on independence with these women, learning how to do routines with their children, like a nighttime routine, a bathing and cooking classes, trying to get them on a regimented sleep schedule and a feeding schedule for some of our moms that are breastfeeding, or if they're also using bottles. We have people on staff at these centers to help them with childcare and learning where they can go send their children if they have special needs. So it really is just a wraparound service that's just, it may look like, oh, they're coming in for drugs. But as we know now, it's so much more than just drugs. It is also trying to get them job skills, trying to get them parenting skills, and also just emotional regulation during that really scary time of trying to get off these substances.
And how do these programs coordinate with other healthcare providers like OBGYNs, primary care, behavioral health professionals?
Mm-hmm. We're finding in Arkansas that with our maternal mortality rate that a lot of our moms are not seeking help during pregnancy. And that's what's leading to a lot of our poor outcomes. So for our specialized women's services, they are able to receive the moms. Sometimes that they will, if they're pregnant, they will actually get them paired up with an OBGYN that's in the area. They will also begin the prenatal vitamins and the regimen needed if they're pregnant. Now, this is if they're with children. A lot of the children maybe need to get on Medicaid and they're not. And so the centers will help them get the children onto Medicaid, which will then also potentially put the mother on Medicaid. And then that will open the door for pediatric care. That'll open the door for any kind of getting a doctor assigned to them for their own healthcare needs. And most of the time it's going to be targeted to that area that they're in the treatment center. So if it's in Arkansas Cares here in Little Rock, they're going to be working with local Little Rock pediatric clinics and also family healthcare clinics. But I will say that a lot of our moms will end up leaving the county. So when they do that, we have caseworker staff on site to call those centers and get them plugged in before they leave so that they have an aftercare plan when they leave and re-enter back into a different county. They're able to get those services started on the phone before they go back home. And so that's so helpful to the mom when they know when I go home, I'm going to be able to already have a plan to follow up with the doctor. And then I also want to highlight one of our pilot programs. Is that okay for me to mention here?
Absolutely.
Okay, so I'm so excited about this one. This is actually coming from our state opioid response grant, which is another federal grant different from the block grant. This one is using River Valley Medical Wellness, led by Dr. Kristen Martin. Her brick and mortar clinic is stationed out of Hot Springs and Russellville, but she also has a couple of mobile units that she got from opioid abatement money from Tim Griffith's Tim Griffin's office, excuse me. And that is such a cool program. She is taking the mobile health care and then being able to meet women in the community where they are, triage them, look at their whole panel of their physical needs, and then reach out to this SWS program and get them into residential treatment if they need it. So then she works with that SWS program and she's able to help them with their physical needs while the SWS program is focusing on their mental health and substance use needs. And it's really a great partnership. And that's a program that we've just started over the last year, I would say 6 months, but it's really a year of her being able to catch moms where they're at in the community and then bring them to SWS. So that's a new partnership that's started, and we're really excited to see the outcomes from that.
And you really answered my next question, which was about how does SWS contribute to breaking cycles of addiction and improving long-term health for families? It sounds like that is happening.
Mm-hmm, absolutely. I think that if you get to do a site visit sometime, or anytime somebody wants to come and visit these programs, they are more than welcome to reach out to me, because I bring that up because the idea of walking through and seeing the babies, there's a law in Arkansas called Garrett's Law that is it's been around for a while, but what happens is that the mother is drug tested when she goes into labor, just depending on the hospital, depending on the policies. She's drug tested at the hospital and then maybe needs to be referred to treatment if they find, that there's substances in the baby system or in her system. So what happens, that could be a very scary and pivotal moment for the mother. Like, okay, what's going to happen? This is a case. Am I going to have to lose my child? Am I about to go into the court? There's a whole lot of stigma that happens, but what SWS does is they take the mother in, and this is a starting journey for her and her child. Do I want to continue on this path, or do I want to start here and go somewhere different? And so if you wanted to visit the site, I bring this up because my last site visit, they had about 4 newborns from Garrett's Law. And I just broke down in tears, because the idea of seeing these babies taken care of while their mother is getting the services that they need, and you get to see the mother so hopeful that there is a chance that their life can change in this moment. It's a very spiritual, it's a very healing environment for some of these families to be able to take this opportunity and turn it into something for them to go on a different trajectory in life. And so I just really like to use that opportunity anytime anybody in the community needs a moment to see that we do have solutions for some of these really complicated problems. You can reach out to me and we can go to those sites and visit some of those babies and see that there are moms doing the best they can with these services that are offered.
What populations of women are eligible for specialized women's services, and how can they be referred?
Absolutely. We have mothers that are, I think that with the age for the mothers, it doesn't really matter as much. So we can take probably 18 and above. But honestly, if they're about 17 and a half, the treatment center can work with them. But I say that because we have the 18-year-old above that for mothers. If you have 2 dependent children, now the ages of those children usually have to be under 7. So, but again, if you have someone over 7 in your household that needs to go with the mom, just reach out anyway and see if there's a way for them to still house that child with the mother. So we have above 18. It doesn't matter if you have insurance, Medicaid or not. Our home doesn't matter. If you have a positive drug screen, probably somebody with a history of substance use disorder is going to be important because it is residential treatment. So, and then really located in Arkansas, I think we have a pretty wide net for people that we accept. And I think that as long as you're able to reach out and ask and maybe fill out probably an intake form that the treatment center offers, they're going to handle you from there for where you need to go next. If you need to go into their site, or if you need to maybe do withdrawal management at a hospital.
And what barriers do typically women face in accessing treatment, and how does SWS remove those barriers?
So some of the barriers, and we actually partnered with AFMC to do a needs assessment. And this was such a great project because they helped identify some of the gaps. And then they took it a step further and have worked with us to build a toolkit to identify the gaps and the solutions. So they did some work in the community for us to do some networking. And they identified that finding transportation for the moms was a big barrier, as well as dental care, which I was actually surprised about. I didn't realize, but if you think about it, dental care is not always covered by insurance. And it's also something that can really affect so much of your well-being, the way that your mouth is, the way you eat, and the way you feel about yourself. And there are a lot of issues going on that our moms were not able to address with themselves or their kids. So AFMC has partnered with community partners and brought them to our SWS centers, and they are now working on getting together and building an action plan for addressing some of those barriers. But like I said, transportation, getting to the treatment centers or getting once they are out. And then also daycare for them was another identified, trying to find appropriate childcare. A lot of our centers have those available, but that it's like a puzzle if you visit them, trying to figure out, do the children go here, 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 here? Are they in school? Are they in daycare? Are they in special services? So that's a transportation need and a daycare need that our treatment centers are still actively trying to work out. So again, just AFMC did a needs assessment. We're hoping that will be finished by the end of this month. What month is this? This is September. So by the end of September, it's coming up soon. They're going to have that needs assessment finished, and we will really get a good look of what are some of the gaps. But those two, dental and transportation, was a big one for us.
And how are community organizations like healthcare providers and DHS working together to strengthen women's behavioral health services?
Oh, absolutely. There's another pilot that we've started. Actually, there's so many pilots. I'm so excited. We're in a really cool time. So when, Robin, when you asked me to speak on this, I was actually, yes, there's a lot going on. For behavioral health needs, we are piloting a program called FCT, Family-Centered Treatment, on the mental health side of the house at DHS. That's working with a lot of our local behavioral health providers, counseling clinics that are getting referrals from a variety of sources. And this is a special program that does in-home services with our moms and children. Okay, so the referrals come in and they are doing what's called family-centered treatment model of care. So that's going to be like a practitioner and a paraprofessional together doing in-home services. And this is with our behavioral health. Well, SWS has now a new pilot with another grant, the State Opioid Response Grant. It's called Family-Centered Treatment, FCT-R. We're adding the R to this one for this pilot. And this is the recovery piece. So this is exciting. We're doing in-home services, and now we're adding the recovery piece, which is for substance use disorder. A lot of time, behavioral health are great at dealing with behavior issues, with like mental health issues, a diagnosis, management, medication management, but sometimes they're not always specialized in substance use disorder. So the R, recovery, we're bringing that in with our SWS family. And that's going to be starting right now. We're doing an enrollment and training. It hasn't started serving families yet, but I will let you know as soon as that does, because we're going to be starting a new program. This is something in Arkansas that hasn't happened yet. This is brand new. And it's going to be in-home services during recovery and also the behavioral health needs for that mother and the child. You know, managing a home, understanding what it's like with the dynamic of maybe there's a husband or a father that needs to be involved in this. And then also case management, identifying how do I make all these appointments and how do I work at the same time? You know, how do I be a successful adult while I'm at home? And so that family-centered treatment recovery piece is going to help the mother really succeed after she gets out of treatment. And that's going to be trauma-informed, healing-centered, but also identifying any of the issues that case management might need wraparound services for.
And what role can healthcare professionals watching today's interview play in connecting women to specialized women's services?
We do have a website. Arkansas DHS does have a website that you can go to get this map of our treatment centers that are available for specialized women's services. believe that the link for that website is a little bit more complicated than I want to admit. I wish that I could create this really short URL, but what it's going to be is I'm going to share with the AFMC team that maybe we can share that out. But I've actually created a flyer that is very easy and has a QR code for each of the treatment centers. So I can just tell you verbally that we only have 4 sites in the state of Arkansas that are providing SWS services, which is Arkansas Cares in Little Rock. And then we have Harbor House, Hot Springs, Gateway, which is also a Harbor House affiliate in Fort Smith, and then Lake Point and Russellville. So if you have heard of any of those treatment centers, they are providing SWS services for us at DHS. And I have a flyer for that I can share.
One last question. Looking ahead, what do you hope to see for the future of SWS and women's behavioral health in Arkansas?
I want to see the momentum continue for this focus. I think that the funding is really not the issue. It's always about trying to get the momentum of our public officials, our community partners, our stakeholders. We need to continue meeting. You can have one big task force, one big summit, one big event. All of that is amazing, but let's keep meeting, right? I want to see our partners in the public health space, the education space, the social services space, all continue meeting and continue working on this program and this process for maternal health. Arkansas DHS has a really big initiative, Healthy Moms, Healthy Babies. And we also have the task force that happened last year. There's a publication that came out about suggestions for our maternal health and maternal mortality, how to improve services. And in that would include all of our partnerships that we have. Let's continue meeting, continue the focus and the momentum to focus on solutions to really bring our moms into the fold of these services. They exist in Arkansas. There is money available to these programs right now. Let's get these moms in the centers and get them wrapped into services so that we don't feel like that there's nowhere for them to go, like how I felt whenever, years ago, just kind of wandering around the system, not sure of where to go for help. I want to be able to have somebody available to them so that they know that that their issues are being heard. And I think that we have those available in Arkansas, and it's unique in that it's a rural part, but we still have those services available. Let's continue the momentum. We're in a great place right now for providing these services. Let's keep doing it.
Well, Bonnie, thank you so much for sharing all the important, really amazing work that Arkansas is doing, that SWS is doing. I appreciate you being here today.
Absolutely. This is so exciting. Thank you for asking me to speak. And I will share my contact information. Of course, anybody is welcome to reach out to me. And if you have any questions about what Arkansas DHS is doing or getting access to our list of providers, just reach out to me and I can answer those questions.
Well, thank you so much for being here.
Absolutely. Thank you.
And that's it for this episode of AFMC TV. Thanks for watching and have a great day.